I'm a medical surgical telemetry nurse, newly diagnosed with triple-negative breast cancer. I haven't started treatment yet, but there's already a stack of practical stuff to get ahead of. Insurance paperwork, hospital bills, and income if I need time off work. None of it is medical, but all of it is real.
The first piece of paper that can throw people off is the explanation of benefits, or EOB. It looks like a bill, but it isn't one. It's a summary your insurance company sends showing what was billed, what they paid, and what you might still owe. The actual bill comes separately from your provider. It's worth checking that the two match, since billing errors happen more than you'd think. Some treatments and scans also need prior authorization, meaning your insurance has to approve them before you get care, so it helps to ask your care team whether something needs that sign-off before it's scheduled. And staying in-network when you can makes a real difference, since out-of-network care usually costs a lot more out of pocket.
Most hospitals also have help built in that people don't always know to ask for. Many offer financial assistance or charity care programs that can reduce or even eliminate what you owe based on income. Nonprofit hospitals are actually required by federal law to have a written financial assistance policy and make it easy to find. And most cancer centers have a patient navigator or oncology social worker whose entire job is helping people sort through exactly this kind of thing. Insurance questions, payment plans, transportation, all of it. The earlier you connect with them, the more options are usually on the table. So it's worth asking who that person is at your very first visit, rather than waiting until a bill feels overwhelming.
If treatment means time away from work, there are two different systems worth knowing apart. Short-term disability usually comes through an employer, though only 5 states run their own mandatory program on top of that: California, Hawaii, New Jersey, New York, and Rhode Island. If you're not in one of those, like here in Maryland, it's worth asking your employer directly what short-term disability coverage they offer, since it isn't guaranteed by the state. Maryland does have a paid family and medical leave program on the books, but it isn't scheduled to start paying benefits until 2028. Social Security disability insurance is a separate federal program based on your work history, and it's billed for longer-term situations. The application and review process usually takes several months, so if it's something you might need, it's better to start that paperwork early rather than wait. Certain advanced cancers do qualify for a faster review called compassionate allowances, but that fast track is specifically for cancer that's metastatic or inoperable, not for every diagnosis, so it's worth asking your care team directly whether it applies to your situation.
Even with insurance, copays and co-insurance add up fast, and this is where nonprofit copay assistance foundations come in. Organizations like the Cancer Chair Copayment Assistance Foundation, the Patient Advocate Foundation, and the PAN Foundation offer grants specifically to help cover treatment costs, premiums, and related expenses. And applying is free. If you're not sure where to start, the Cancer Financial Assistance Coalition keeps a searchable directory of programs by diagnosis, so you can see everything you might qualify for in one place, instead of hunting foundation by foundation.
The system that's worked for me so far is simple. One folder, physical or digital, for every EOB and every bill, so I can check them against each other before paying anything. It's not glamorous, but it takes some of the uncertainty out of an already uncertain time. And none of this is something you have to figure out alone. Between patient navigators, hospital financial counselors, and these assistance programs, there's more support built into the system than most people realize going in.